Hey everybody, how are you doing? This is Kirsten here, and you are watching or listening to A Better Way with Kirsten podcast. If you're watching this right now on YouTube and you like this video, you find it helpful, please leave it a thumbs up. There's a button just under this video. Leave it a thumbs up and also subscribe to this channel if you haven't done it yet, because that way, every time I post a new video, you will get a little notification on your phone that tells you that there's something new to watch. If you are listening to it on Spotify or Apple Podcasts, then you can also follow me there, follow the show, and you can also leave me a 5-star rating and a review because that way more people will find the show and get help. What we're talking about on this show is something called TMS. It's also known as neuroplastic pain, and it has many other names too, but basically it means that you have some sensations, pains, uncomfortable sensations in the body that are not actually originating from anything physical. And the root cause is actually in your psychology, right? There's something going on with your stress. You have a lot of stress, you have a lot of internal stress. Maybe you haven't expressed your emotions. Maybe you have certain personality traits that actually put a lot of pressure on yourself, such as people pleasing, perfectionism, super afraid to make any mistakes. So you keep pressuring yourself all the time, something that we've talked about on this podcast before too. And this is how you start developing these chronic sensations in the body. If you're always rushing around doing a million things at once, this is another one because that puts a lot of pressure on you. And on this podcast, we're going to talk about what you can do then to start recovering from this type of pain. And of course, I want to make sure that you have been checked out by a healthcare professional uh, who has made sure that there's nothing going on that is like truly physical and needs medical attention. But if you have been to many, many practitioners already and nobody's been able to figure out why you're having these sensations and pains, or maybe they think that they know, but the treatments are not working, then you have to look into this nervous system work that we're talking about on this podcast. Now, when you get these physical sensations in the body, whether it is your back pain or something else, it is really important that you respond to them the right way. And this is what we're going to talk about today. There are a couple of different ways how you can respond to this TMS type of pain. And what we have to keep in mind here is that there's nothing to worry about really, because this stuff is not physical. So you don't have to worry about it. You don't have to go Googling more. You don't have to do more research. What you can do is to relax and accept that this is totally fine. It's not harmful and it's not bad. Now, let's talk about a couple of ways to respond. Let's say you get a sensation or pain or something like that in the body. You're like, oh no, what is this? And then you remember, okay, this is TMS stuff. It's not harmful. So what do I do about it now? Now, the first way that sometimes work for some people is to tell the pain to leave, right? Dr. Sarno said that in one of his books. He said, just tell your brain that I'm not going to take this anymore. I'm done, basically get out. And I think it can work for some people, because Dr. Sarno talked about it. He was able to help his patients with it. And there's plenty of people after him who have used this to like, okay, I'm done, brain. This is stupid. This is bullshit. Leave, right? And it can work for some people. However, I have personally found the other approach better for me. And this is the one that is more accepting and allowing. So, not trying to push it away, not telling the brain that stop it. Again, I want to say it works for some people, but I have found that for me, it has been much better to accept and allow and kind of soften and kind of lean into it, into this sensation. So, I want to give you one example. So my main symptom was always back pain. And I still have a little bit of like tightness feeling, but I don't have this stabbing sensation anymore that I used to get all the time. It was like sharp, it was very strong. It felt like knives in my back. It was really bad. And as I talk in my program, Emotion Fit, this type of stabbing sensation often means that you have unresolved anger. This is how anger likes to show up, stabbing sensations. If you have any of that, or you have like a lot of like heat and burning, that can also be anger. So when I used to get that, and I'm so happy to say that I don't really get that almost at all anymore. When I would get that, what I would do is that instead of saying that, hey brain, knock it off, like this is stupid, I tried that, but it didn't really help me. What I started doing was relaxing into it and either like sitting down or laying down and making sure that my body is completely relaxed. So if I wanted to, as a protective mechanism, tense up the muscles around the painful area, I would pay attention to that and stop it, right? Let go, like fully let go. And it can be a little bit scary because you think in your brain, or it's actually not even that you're thinking, it's like instinctual that you tighten the muscles up because you feel like that way no harm can be done, right? Like I protect myself. But you got to remember that there's no harm anyway because TMS is not harmful. So it's important that you let go. So I let go of the tension as much as I could around the area where I had the stabbing sensation, but also anywhere else in my body. Sometimes I would just like tighten up my thighs. For that was a very common thing to like always keep my thighs really tight and tense, or like shoulders were tight, or maybe hands were like this, like making a fist or something. So just making sure that that I fully relax. And then with the pain sensation, I would just let go and watch it and be with it. And it was almost like somebody's coming in and wants to tell me something and I'm listening. So I'm not saying that, get the fuck out of here, or like, oh, I'm not gonna listen to you, or like fighting back. You're like really soft, like, okay, here we are. I'm gonna listen to you. It's like, come on in, sit down, tell me what you got. And I was thinking about it. It's almost like, let's say there's like a child who has some sort of confession, like, and she's kind of afraid to tell you, but she's telling you. So what are you going to do? You're not going to tell the child to just, you're not going to hopefully start yelling at her if she has a confession to make, or you have a friend who has something difficult that she's going through and she wants to share this with you. Hopefully you're not going to start like judging and fixing and whatever, right? You just listen. And I feel like this is the same way how we should handle chronic pain. You just listen, like do what you need to do, like tell me more type of thing. And then you just lay there or sit there and try to keep your body as relaxed as you can and just, feel whatever is going on and knowing that there's nothing harmful that's going on right now in this part of your body or anywhere in the body. And so I found that when I do that, like when if I get a sensation now too, then I just relax into it. It's like full surrender mode. And it's not the same thing as giving up because we're so used to thinking that if I don't fight back, this is like giving up. If I don't give it my all, then this is just like being weak, or meaning like I don't care and I do care. But you really have to drop this mindset of like I have to get rid of it so bad. It's the opposite. You have to almost like with your open arms go like, all right, let's do this. Like, come on in. Tell me what you have to say. And then it's almost like you're giving this sensation permission to be there. And then after a little while, it starts to fade away and you start to relax into it. And this is not to say that it's not going to come back ever. It's still gonna, but you keep training the same way. Like you're still allowing. And of course, if this first approach, which is like, telling yourself, I'm not going to take this anymore, get out. If this works for you, this is great. I always say, like, whatever you find that works for you, just do that. Today, I'm just sharing with you what worked better for me personally. And this is the allowing and accepting. Now, however, I want to tell you one time where this fighting and like this more like anger filled approach worked for me. So there's one time when I had a call with my coach, and I was really new to coaching or working with him. And he started asking me about emotions. And at that time, I didn't know anything. I was like, I don't have emotions. I'm not an emotion person. I'm kind of just like calm and collected most of the time. And I didn't know anything. I didn't know anything about emotions then. But he was kind of like poking around. He's like, okay, well, how do you feel this? How do you feel about this? How do you feel about that? And I still gave just like neutral answers because that's how I felt, just like neutral about things. And then he asked me, well, how do you feel about this pain? And I was like, oh, this is so annoying. Like, I'm so done with it. And he's like, okay, what is this? What do you think this emotion might be? I was like, I'm angry at this thing. He said, yeah, exactly. You're angry at this thing. So what do you want to tell this pain? And then I really kind of opened up then. I just like a lot of anger came up. I was like I'm so pissed that this thing has been going for fucking 6 years now, and how bad, like this is just so bad, and I'm so tired of trying all these methods and nothing is helping. And I just poured this anger out. And I did get relief from that. Of course, you get like emotional relief, but I actually did for a couple of days. I felt physically lighter too, because this was like it was like a big thing that came out of me, because like I had not really expressed my emotions before. So this is a good evidence that it can work sometimes. But what I did next was not what worked for me anymore. I started thinking, and now I have to do this all the time. So I took this approach of like starting like yelling at my pain all the time, like, using a lot of, bad words and whatever, like, get out of here. And I would literally go for a walk and just like talk to myself and like stomp my foot down and like, get out of here. Like, this is enough. And I did it. I did it for like a week. I was trying. See, here's the thing too. I was trying so hard. Oh, this one thing worked that one time. And I have to stick with it because this is the magic thing here. This is what I've been missing the whole time. I just have to yell at this thing. But it wasn't, because I didn't get better from it. Like the pain and the tightness and the stabbing thing, they all came back. Because it wasn't what I was actually supposed to do all the time. It was like in this moment when he asked me, how do you feel about this? And it all came out, and it was the right thing to say or do, because that's what I felt then when he asked it. But later, it was almost like I was trying to like artificially kind of like manufacture the anger anymore. But I was not angry at the moment, but I was just thinking, okay, I have to do this again because this worked this one time. Right. And this is where I went wrong. So I think I tried like for a week or two. I was like so desperately trying the same thing. It has to work because it worked that one time. And it didn't. And then, then the conclusion that I came to, and that was later on, was that no, like you can't like constantly be this way and constantly yell at the pain. Maybe some people can, and maybe they find it helpful, but for me, it wasn't. It's like you have to like the emotion that comes up in the moment, right? This is what you use, right? That moment when he asked me this question, I was angry. That's why it helped me. But later, it wasn't anymore. So later, what became more helpful and more important for me was relaxing into it. And this has proven now, it's like maybe about a year later from that one incident that I talked about, I've been doing this a lot more consistently, like relaxing into it, letting it be there. Again, like thinking maybe there's a friend who wants to tell you something, so you're just listening, or you're just like watching what's going on without interrupting or without trying to push this away or like distracting yourself with something. I think distraction is also another one. It's like we just try to like, basically ignore the sensation, just distract. And, I think it's a fine approach. Like if you, after experiencing it, you go think about something else, right? But don't skip over it. Don't go like immediately, okay, I'm going to do something else. I did it all the time. Like my go-to was like work more, because I tend to work too much. So it was always like, okay, I'm just going to ignore this tightness. I'm just going to work more. So the thing is, you still want to feel it. You still want to feel, okay, there's stabbing or there's like heat waves or whatever it is. Feel it, be with it, allow it to be there, but don't stay there, right? And then you're going to go and do something else. You're going to do normal everyday things because you are a normal person, right? But don't skip over those sensations and like fully feeling them. And the same thing is true for emotions too. And again, I talk about it in my emotionally fit course too. For example, when you get anxiety, and there's a huge module on anxiety, this is the biggest module in the whole course. So there too, I don't say anywhere that, fight back, tell this anxiety to get out, or like, fight so hard, make it go away. No, everything is about like, let's lean into it, feel it. What is it like? Does it feel in your chest? Feel like your stomach's getting upset? Your mind is filled with million thoughts. Is that what's going on? Because if it is, just feel it. Try to be with it and fully open up to it and allow it and accept it. And this is how your anxiety starts to dissipate too. And the same thing is true for sensations in the physical body, because as you know, these physical sensations a lot of times are your emotions. And that's how they come out, because you haven't addressed your emotions. So the approach is the same. It's more like, it's so much more about allowing and softening and accepting than it is, in my opinion, like fighting, pushing back, forcing it to go away. So, as always, whatever approach work for you and helps you to get rid of chronic pain, do that. So if you find like being really kind of firm and like kind of like angry and pushing it away, if it works for you, that's really great. Like I'm absolutely not saying that how I'm teaching you is like the way and the best thing or the only right thing. But I definitely encourage you to explore different ways and different things that work for you. And I always share with you like what has worked best for me. So this is all I have for you today. If you're interested in the Emotionally Fit course, then check out the show notes and I will talk to you again very soon. Take care.